A linear array transducer with a nerve exam type is used to perform an ultrasound-guided supraclavicular regional nerve block. The target depth is approximately 1 to 3 centimeters in an 80-kilogram adult. The patient is positioned in a 45-degree reclining position with a pillow under their head and the neck exposed on the operative side. The patient's head is rotated toward the contralateral side. The examination begins by finding the supraclavicular region of the brachial plexus as a landmark technique. The transducer is placed posterior to the midpoint of the clavicle at an acute angle, with the orientation marker directed to the patient's right at a 10 o'clock position, with the transducer aimed into the thorax. The subclavian artery is seen as a round, pulsatile structure superior to the bright reflection of the first rib. The pleura is seen as a bright hyperechoic reflection, deep to or at the same depth as the first rib. The nerves of the brachial plexus are posterior or superior to the subclavian artery. The nerve trunks appear as hypoechoic dark circles within the bright hyperechoic fascia of the brachial plexus. Color Doppler imaging may be used to identify smaller arterial branches running through the brachial plexus or lying in the path of needle advancement. The needle is positioned 1 to 2 centimeters lateral to the transducer and advanced using an in-plane technique. The initial end point of the needle is just posterior to the artery immediately above the first rib. It is important to distinguish the pleura from the first rib to avoid a pneumothorax. The local anesthetic is injected incrementally close to the nerves. The needle can be redirected towards the upper trunks of the brachial plexus if the spread of local anesthetic is not deemed adequate.